The first panel and the first person up, Dr. Christy Huff.
So I'm here to testify in support of the informed consent bill for benzodiazepines. I'm a cardiologist and the director of Benzodiazepine Information Coalition. I'm also a survivor of taking benzodiazepines as prescribed. At 31 months benzo-free, I still suffer symptoms of protracted withdrawal, and I'll provide a written summary of that experience, but today I'll be sharing some insights from my advocacy work. I've had the privilege of talking with thousands of individuals harmed by these drugs. The majority are good patients who took their medication as prescribed, yet still experienced adverse effects and prolonged and difficult withdrawals. We know between 15 to 44% of long-term benzo users experience moderate to severe withdrawal symptoms upon discontinuation, and at least 10 to 15% can experience protracted symptoms lasting months to years, possibly even permanent. Not everyone experiences a difficult withdrawal, but for those of us who do, the impacts are devastating. After my own experience, I realized that I had received very little instruction on the risk of these drugs during my training. In fact, I myself, a physician, had to learn to taper from other patients in support groups. In September of 2020, the US FDA updated its benzodiazepine boxed warning to include the serious risk of physical dependence and withdrawal. Prior to that warning, they did an extensive review on benzodiazepines, and they documented numerous concerns that benzo safety advocates have been voicing for years. I'll review a few of those here. First, that benzo abuse and addiction primarily occur in the context of polysubstance abuse and not in the as-prescribed patient population. Next, that adverse events can and do occur with prescribed therapeutic use. That withdrawal can last months or even years. The new warnings include the potential of a protracted withdrawal syndrome lasting 12 months or more. And lastly, that physician education about benzodiazepine safety is lacking. The FDA is correct in this assessment. I have seen this in advocacy as well. This is leading to improper deprescribing where patients are being cut off too rapidly, resulting in severe withdrawal symptoms, and under recognition of adverse effects and long-term risks, which leads to misdiagnosis and unnecessary medical testing and treatment. This lack of education is translating into inadequate informed consent for patients. In a 2018 online survey, only 6% of benzo users said they had been clearly warned that these drugs should be taken short-term or that they were difficult to withdraw from. I feel strongly about the need for informed consent surrounding these drugs, so I authored a written consent form for use in clinical practice, which includes the information I wish I had been told prior to starting a benzodiazepine. Today, I urge you to listen to the voices of those with lived experience. Patients are continuing to be harmed by the physician knowledge gaps surrounding these drugs and the resulting lack of informed consent. If passed, I believe this bill has the potential to save many lives. Thank you.